Hey y'all, it's the Queer Nerd, and my name is Adrian. Today I'm going to be talking to you about my top surgery consultation, some of my thoughts, doubts, questions, stuff like that about top surgery, and a little bit of gender blabble in general because I've been thinking about gender a lot lately. So first of all, I had my top surgery consultation last week with Dr. Kim at the University of Minnesota, and first of all, the consultation went really well. I was kind of expecting some weirdness because I'm non-binary. I'm not a trans man, but it was all really cool. Everyone seemed to be in the know about non-binary stuff and terminology and things like that. So they were all really helpful. So I'll go over kind of what happened. So I show up. First, I talk to a nurse who takes super basic information, height, weight, stuff like that. Then the transgender care coordinator for the trans clinic at the U of M came in and talked me through some information, told me what they were going to do. They were going to measure my chest and stuff. And so he just kind of told me about some timelines and gave me some more information basically. And he really helped me feel more comfortable there because he's trans, and he was very knowledgeable about what was going on and stuff and made me feel welcome. So that was helpful. And then Dr. Kim came in, and he had a medical student following him that day or whatever, so I was yeah, she can come in too, med student. And so they came in, we talked for a little while. My mom was there with me, actually. So we talked to Dr. Kim about my transition, told him that I've been kind of out to some extent for 3 years and thinking about top surgery for most of that time. And he said, so do you identify as non-binary transmasculine? I said yes, so I'm not sure if he just guessed that or if maybe it was in my chart. Probably in my chart, because I must have told them when I got referred to the clinic or whatever. And so we talked a little bit more about my history and why I want top surgery. I basically want top surgery because I don't want to have to bind all the time. I always have the urge to bind, and I can't bind every day because it hurts me too much now. But I told him I can't bind every day, and it hurts me physically. And he's like, how does it hurt you? I'm like, well, my ribs and my back and whatever. And talked about that a little bit, and he's like, how sure are you that you want top surgery? I don't remember if he asked me this before or after the actual exam, but at some point I was like, well, I don't know how I don't know what percentage to give, so I said 98%, even though I feel more probably 60%, maybe even 50% sure that I want top surgery. But I said 98 because I didn't want to be gate kept. I didn't want him to be well, you have to be more sure or whatever. So I just said 98%. And he's like, how can you be that sure you want it? This is a very permanent surgery. And I was like, oh, that's not the reaction I was expecting, right? But he was not he was just surprised I was so sure, I guess. But I'm well, I've been thinking about this for a long time. I know that I want surgery. I'm just worried about the recovery and pain and results, stuff like that. So we talked for a little while. Then he did a physical exam. So he basically had me. Everyone left the room. I put on a gown with the opening on the front, and then Dr. Kim and the medical student came back in. My mom stayed outside. Basically, I had my gown and opened my gown so that I was not wearing anything underneath it. And put my gown down to my elbows, kind of down here. And then he measured my chest, measured from some distances between my nipples, between the middle of my chest and my nipples. He kind of poked at my chest a little bit. He didn't grab or anything. And then he didn't really say much when I was looking at my chest, except for oh, you're very thin, or I'm like, yeah, I'm thin, okay, he could have told them by looking at my arms, right, but whatever. And then after that was all over, he told me some stuff about my body that I already knew, and then he's like, oh, I was not expecting him to say this, but he said I would be a good candidate to get keyhole or periareolar. So what he first said to me, he said after I had been clothed and everybody came back in, he said you could get any of the 3 procedures. He said I was a very unique case. I could get any of the 3 procedures. And I was like, okay, does he mean keyhole, peri, double incision? But he said, so he thinks about keyhole and periareolar as one procedure, apparently. So that procedure to him is one of my options. Another option was kind of T-anchor, not exactly. It didn't have the extra line scar. But basically he would have had to leave some breast tissue behind. And he said for me, because I'm so thin, it wouldn't have been aesthetically flat enough for me probably if he left some tissue behind. So he said, don't do the middle option. So your options are either like double incision, which is the third option, he said, like traditional double incision with free nipple grafts, or keyhole / peri-areolar. He said, do you have like a preference? And I said, well, I would like to get like peri if it would be a good option for me, but I just know that like sometimes the results like aren't as good or whatever, and like it's not an option for everybody, so I just want to make sure whatever. I don't really have a strong preference though. Actually, he did ask, do you care about like scars or whatever? And I said, well, I'd like to not have scars, obviously. I'd like to have minimal scarring, but I've made myself comfortable with the idea of having scars. And he said, what's like, is nipple sensation important to you? I said, not that important. But I would like it if possible. So he said, I'm going to recommend peri for you. I don't want, he like said this, he's like, I don't want to put big scars on your chest, Adrian. I'm like, oh, okay, well, thanks. And I was really excited at that moment because I was like, well, I can get peri, that's cool. But then later I've been thinking for like the past few days or whatever, like, I might still get double incision just because I'm afraid of like having extra skin. And like I've seen some results from peri where people have like where I don't know, there's just like not desirable results from peri-areolar that I've seen, and my chest is on like the bigger side of peri chest. I from what I've seen on the internet. But Dr. Kim said he could do it. He said that's the one he like wanted to do. He recommended that for me. But I'm a little scared of it, so maybe I'll have to think about it. But anyway, I'm gonna have to think about it anyway because at the end of my consultation, I was like, well, I'm going to school in the fall, and I'm probably leaving for school in like a little bit over a month. So, like, I can't do surgery right now. So he's like, well, you can do break or something. I'm like, well, my break is only like a month long. And he said, well, the surgery recovery is like basically 2 months. So maybe just wait until next summer. And he said, so come in. If you still want surgery in 6 months or whatever, come back and see me and we'll talk. I'm like, okay. So it's kind of weird the way he said it. Like, if you still want surgery, like, I definitely still will want top surgery, but whatever. At least that's what I thought in that moment. But then, since I've been home and thinking about it, so that's how my consultation went in general. My consultation went well. And I was excited leaving. The one thing I forgot to ask for was results pictures because Dr. Kim doesn't have a ton of results pictures on the internet. I actually didn't find like more than maybe a couple because he's kind of like a newer doctor. He's pretty young. I want to say he's like in his 30s or something. But I think he's reputable. Like, I've heard good things about him. I just don't know his skill level, so I forgot to ask because I was so excited that I could get peri, but I'll ask or call them and ask or something eventually. So now, post consultation, I'm like thinking more about like, do I actually really want top surgery? Because like, it is feasible. Like, I could probably schedule a date. I'm gonna wait till next summer, but I was just thinking about it, and like, it's just so hard for me to justify me getting top surgery, I guess, because I don't have like the typical trans narrative of like, oh, I hate my chest every time I shower, I have like super bad dysphoria, I can't look at my chest, blah, blah, blah. Like, that's like, a lot of people have that experience. I don't have that experience. Like, when I'm like by myself, I don't really have a problem with my chest. Like, when I'm wearing, weirdly, like when I'm wearing a shirt or something when I'm by myself, I do have a problem. Like, I want to bind, but then like, if I'm just nude, I'm just like, naked bodies are just like weird looking anyway. So I'm not like repulsed by my own chest right now, so it's kind of hard to say like, oh, like the traditional narrative is like, oh, take away this piece of my body that I hate, right? Like, and that's not me. Like, I don't hate my body. I don't hate that part of my body. It's just like annoying, and for some reason I don't want people to see it, and it's like, I don't know why I feel like this. Like, okay, obviously like dysphoria, yeah, but like, what is the dysphoria caused by? Because I'm not a man, so I don't want people to, it's not like I always want people to think I'm a man. But sometimes, like, I don't want them to think I'm a woman, right? So, like, I don't know. That's why being non-binary is confusing for me. And I was thinking about this the other day. Like, I just wish that I could be more binary sometimes, because it's really frustrating to not have a roadmap, right? And, like, I like being non-binary. Like, I enjoy it. I actually really like being non-binary, and I like being trans. Because sometimes I feel really free being non-binary because I can just dress and do whatever I want. But I can really only do that when I'm around people that I know. like if I go to a music festival or something and I am going to be around a ton of strangers, I can't go to the bathroom if I dress how I want to dress, right? Because people will misgender me the opposite way of either bathroom I go in. So I have to dress one way or another so that I can go to the bathroom in public. But if I go to like whatever, to a restaurant with my friends, I'll just have one of them go in the bathroom with me, and then I don't have an issue. So it's just like, I don't know, that's frustrating. So then I wonder, is that why I want top surgery? Because I can pass as male more easily, so then people don't think I'm a girl. But that's not even why, because when people think I'm a man, when I pass as a male, I do still feel uncomfortable. Like I feel uncomfortable when I'm passing as male and when I'm passing as female. So that's why I just wish that society would learn about non-binary people, and then people could see me as non-binary, and I wouldn't have to deal with all this. But anyway, it's very frustrating. And I've been thinking about that a lot lately. It's just very scary, I guess, because I'm going to school in the fall, starting college, and meeting a bunch of people that I've never met before, and they're going to either perceive me as male or female, unless they're like also trans and very like enlightened or whatever about gender. Then maybe they'll like see me and be like, oh, maybe that person's non-binary. But like, what? Maybe like less than 1% of the world does that right now, right? So that's unlikely. But they're going to see me one way or another, and I'm going to probably come out to them as non-binary. But like if people see me as a guy, I usually don't come out to them as non-binary, at least right away. Like at work, I'm not out as non-binary. People just think I'm a guy. But like if people do perceive me as a woman, then I have to come out as non-binary, because I cannot deal with being perceived as a woman. Like it's just so cringe. So I don't really know what to do about that. And I've just been thinking about that and thinking about top surgery a lot. And I think it's because I'm not really busy right now. Like in some ways I am busy, but I also have a lot of free time. So I'm just sitting around thinking about it, and it's not like it's not like I have physical dysphoria, like gross, I hate my body right now, but it's just like I'm thinking about gender a lot, thinking about how I fit into society, and I don't fit in what society traditionally thinks are like the boxes that we traditionally live in, right? So I've been struggling with that lately, and I just stopped seeing my therapist because they got a different job. So and I didn't get another therapist because I'm only gonna be here for like a month before I go to college. So I thought I'll be fine for like a month without a therapist, right? Well, I guess I was kind of not right, because I was like crying in my car the other day thinking about how I don't fit into a binary, right? So I don't know if any of you guys have similar experiences where you're frustrated by the gender binary. Please share them below, or like talk to me, because it's really frustrating and I don't know how to handle it. I act like I do, like I talk to people and I pretend like I have everything together and like I'm the best, coolest, most chill non-binary person ever or whatever. Like I totally know my life. I know what I'm doing with my life. I have goals. I have like a structure. But that's not true. Like I can pass, yeah, but like I don't always want to pass. I don't want to pass as either gender. I want people to see me as non-binary, because that's the truth. Like I'm not a man or a woman. I'm not a boy or a girl. So that's the hardest part. It's like no matter which way I'm doing it, I'm lying to people. That's how I feel. So anyway, thank you guys for watching. Hopefully you got something out of this, or could relate, or learn something about top surgery consultations. I'm going to have to wait a while for my actual surgery, like I said, because I'm going to college. So there won't be a ton of updates about top surgery unless I go like to another surgeon or something for a consultation, which I might do. But like honestly, in the Minneapolis area, with health insurance, it seems to be not that hard to get top surgery. So I'm happy that is how it is, I guess. So my journey is not that long. I've also been thinking about testosterone and a bunch of other things, so maybe if I look more into that, I'll make more updates, or I could talk about how stuff is when I start college. But I'll let you guys know. Anyway, thanks for watching, and peace out, nerds.